This is Sirius XM Doctor Radio.
From the heart of the NYU Langone Medical Center, this is Plastic Surgery.
Good evening. My name is Dr. Stephen Warren, and I'm hosting the Plastic Surgery Show here on Doctor Radio. Tonight we're going to talk about life after breast cancer, and we'd love to hear from you tonight once we get into the discussion. Our number here at the NYU Langone Medical Center is 1-877-NYU-DOCS. That's 1-877-698-3627. You can also email us at docs@siriusxm.com. Well, this evening I'm joined by Dr. Constance Chen, who is a board-certified plastic surgeon who specializes in microsurgery and breast reconstruction. Welcome to the show tonight, Dr. Chen.
Thank you very much.
And tonight we're going to talk about life after breast cancer, and I thought this was an important topic to talk about after I read a June 20th New York Times article that featured Dr. Chen and her work. And the reason why I wanted to bring this up tonight was today about 1 in 8 women in America will develop invasive breast cancer. So that's about 12% of all women will develop breast cancer at some time in their lives. And after skin cancer, breast cancer is the most common cancer in women. It's really pretty amazing. In 2010, over 207,000 new cases of breast cancer were diagnosed, and more than 54,000 cases of in situ cancer, that's pre-cancer, was diagnosed. So in total in America, nearly 250,000 new cases of breast cancer were diagnosed last year. Now, over the last 10 years, the mortality from breast cancer has been declining at roughly about 2% per year. So when you look at it today, what is amazing through modern medicine is that the overall survival for all women with breast cancer is about 85%. That means today about 4 out of 5 women with a new diagnosis of breast cancer will survive. And that's very different than when I was in medical school 20 years ago, where breast cancer was, I don't want to say it was a death sentence, but women didn't do as well as they did today. Today, there are over 2.5 million breast cancer survivors living in America today. And they're living because of the therapies that we provide for them. Women can have chemotherapy, radiation, hormonal therapy. There are new experimental protocols with immunotherapy. But one of the things that underlines all of the breast cancer treatments is surgery. And surgery is an important part for treating the cancer, but then also rebuilding women's lives after surgery. And what I wanted to talk about tonight was living living after you survive your breast cancer, your diagnosis. Some of the treatments we provide today have complications. Radiation can cause skin burns or hair loss, nausea and vomiting. Chemotherapy can cause anorexia. And surgery, of course, taking out the cancer can lead to wound infections or seromas, a thing called a pneumothorax where air gets into the lungs. And another complication of surgery is lymphedema, and that's one of the things I wanted to focus on tonight. And that brings me to this June 20th New York Times article entitled Treatment May Help Ease Effects of Cancer. And when I read this article, it really caught me. There's a quote in here, Dr. Chen, in reference to you. It says that more than 2.5 million women in the United States are alive today surviving their breast cancer diagnosis. And some studies suggest that within 5 years, the problem lymphedema can develop in as many as 40% of women who have undergone breast cancer surgery. And that's pretty impressive, because when I think back 20 years ago when I was in medical school and 15 years ago when I was in general surgery, lymphedema was sort of one of those things that we talked about a lot, but we didn't see. And this 40% is really pretty amazing. What's been your experience? How do women present with this? Or first of all, what is lymphedema, and then how do your patients present with this problem?
Lymphedema is a swelling of the arm that occurs after either mastectomy or a lymph node dissection or radiation therapy to the lymph nodes. And lymph nodes are a structure in the armpit or the axilla that drains fluid from the arm. And after surgery or radiation, those lymph nodes can get damaged so that the fluid cannot be drained from the arm. And the way it presents is women will complain that their arm is swollen or painful or is somehow feeling heavy and non-functional. But interestingly, there was a study done at the University of Iowa several years ago that showed that 92% of women who complained of these symptoms after being treated for mastectomy had never been diagnosed or treated for lymphedema.
So let me understand that. So the arm swelling that occurs after a woman undergoes a mastectomy, for example, with axillary lymph node dissection, taking out those little lymph nodes underneath the arm to check them for cancer, a woman can develop swelling in her arm.
Yes, that's correct.
And does that happen right after surgery, or how long can that take to present?
Usually it doesn't happen immediately after surgery. In most patients, it will happen within 3 years of surgery. But there have been studies that have been done with up to 20 years of follow-up, and any patient who has undergone a mastectomy is actually at lifetime risk of developing lymphedema, even if she doesn't develop it within the first 3 years.
So it's sort of an insidious process then that maybe over time, after the woman survives her breast cancer, slowly over time, the arm may get a little heavier, a little more swollen. It may be more difficult for them to get their rings on or off their finger. And so in the study you referred to from University of Michigan, the diagnosis often goes unrecognized.
That's correct. So that women would come in saying that they couldn't wear their jewelry, or they could no longer wear long sleeves, or they had ill-defined pain or discomfort. They could no longer use that hand to write. They couldn't see the veins or the bones of their hand. They couldn't go shopping. This is a condition that really impairs people's everyday life. And what's more, many women will say this problem affects them and bothers them more than the actual breast cancer because it affects them so severely in their everyday life.
Mm-hmm. So you've had patients who will come in and say, the problem I'm dealing with now, this arm swelling or lymphedema, is even more troubling than the cancer I was originally diagnosed with.
Yes, and I think part of this is because when a woman has breast cancer, she's undergoing treatment. Everyone recognizes that she has a disease that needs to be treated, and she's fighting for her life. But once the breast cancer has been dealt with, and as you pointed out, 85% of women go on to survive their breast cancer, then many of the woman's family and friends, and even physicians sometimes, will say, well, you've overcome your breast cancer. I don't know what the problem is. Yet the woman says, well, I can no longer carry on with my hobbies. I can no longer go shopping. I can no longer work because I can't type.
Mm-hmm. So the arm swelling can be quite incapacitating, preventing them from doing their activities of daily living.
That's correct.
So why do you think it is? I mean, there's probably no answer to this, but why do you think it is it doesn't get recognized more frequently? Is it just because it's a slow, insidious process and people say, you've been cured of your cancer, what are you worried about? Or is it just because therapies are, there aren't really any great therapies for lymphedema?
That's a great question. I think that there are a number of reasons why it's not well recognized. Number one, I think that many breast surgeons or radiation oncologists feel that lymphedema is a complication of their treatment. And so, as such, it's hard to recognize and admit that their patients may develop lymphedema after their treatment. That said, this is a known complication, if you will, of or outcome of surgery or radiation. So it's not actually the fault of a physician that this may happen. Patients can develop lymphedema even after one lymph node has been removed, or it has even been reported that patients can develop lymphedema after no lymph nodes have been removed. You can develop lymphedema after radiation therapy alone. the lymphatic drainage, the lymphatic channels are very delicate structures, and if they are damaged in any way, or if the scar tissue around the axilla or armpit squeezes out the lymphatic channels, then the lymphatic drainage cannot occur. And that is not necessarily the fault of any physician. It is just something that can happen.
I see. So for our listeners out there, we're talking about life after breast cancer, dealing with the complications of surviving your cancer. And one of the things that we've talked about tonight or focused on is lymphedema. There are many complications that can occur after successful cancer treatment, and we talked about that, the burns that might occur from radiation or the nausea or vomiting that might occur from chemotherapy. But Dr. Chen, you brought up an interesting point, which is unlike the nausea and vomiting, for example, that occurs with chemotherapy, the time, the connection between those two, you take your chemotherapy and the nausea and vomiting occur shortly thereafter. That isn't the case with the lymphedema. The operation can be a huge success. The woman is cured of her breast cancer, and then weeks, months, as you pointed out, on average 3 years could go by before the lymphedema begins to set in, and it's a slow, gradual process that over time eventually prevents the woman from doing many of the activities that either are necessary for taking care of the house or going to work or taking care of the kids or going out and doing whatever it is they like to do.
That's correct. And, many, after radiation treatment, the radiation oncologist may not be seeing the patient 3 years later. So he or she may not know that his or her patient has developed lymphedema. Likewise, there are some breast surgeons who see patients for the rest of their lives, but not all of them do. It's by no means expected that is what happens. I saw a patient in my hospital a couple weeks ago who had bilateral mastectomies in 1984. It was not until 1991 that she started to notice that her arm was feeling heavier and more painful. 20 years later, I saw her. And I saw her because she had seen this New York Times article and came to my office. And she said that she never knew that she had lymphedema, even though she had been hospitalized 7 times for infections of her arm that occurred because of her lymphedema. In fact, cellulitis or a skin infection is something that very commonly occurs with lymphedema. And this woman had been hospitalized 7 times over the last 20 years for IV antibiotics after developing an infection of her arm, and she also had an additional 3 infections outside of the hospital. The only reason she even knew she had lymphedema was she went to Canyon Ranch 6 months ago, and her massage therapist there told her, you have lymphedema. You should be treated for this. She had no idea. Over the last 20 years, she's seen many, many medical doctors, including doctors who had admitted her for infections of her arm that was swollen, heavy, and painful after mastectomy.
Wow. That's an amazing story. Well, tonight you're listening to us here on Doctor Radio. This is the Plastic Surgery Hour, and we're talking about life after breast cancer or surviving the complications of your breast cancer therapy. You can call us tonight at 1-877-NYU-DOCS. That's 1-877-698-3627. We'd love to hear from you tonight, or you can send us an email at docs@SiriusXM.com. Well, tonight I'm talking with Dr. Constance Chen, who is a plastic surgeon and a specialist in breast reconstruction, about life after breast cancer and what women go through after they survive their breast cancers. From time to time, it can be a rocky road. You just talked about a patient who came into your office who 7 years after her initial surgery first began to have arm swelling. And that went on for a total of 13 more years. And then you saw her at about the 20-year time point. And during that time period, she suffered from the lymphedema, and it went unrecognized. That's really pretty amazing. And it wasn't until she was at a spa that someone outside the medical field picked up on the fact that her arm swelling was probably related to her life-saving breast cancer surgery that caused this lymphedema.
That's correct. And since no one had recognized she had lymphedema, she had never been treated for